in my husband's case, instead of us paying $4,000+ for surgery, physical therapy, we would have only paid $1,500 and the rest would have been shared. Hey guys, I'm Abby Johnson with Matterhorn Business Development. I am very nerdily excited for today's video. I myself and my family have struggled with health insurance and limitations and costs surrounding that, and I have been so happy with the alternative that I have found. It's literally life-changing, and I'm just so excited to finally share it with you today. Typically on this channel, we're talking to business owners, and I know a lot of business owners have to provide their own health insurance. If you aren't a business owner and you're just an employee of a business that doesn't have benefits or whatever your situation is, you are totally welcome here in this video. I want you to check out our free community, Growth Hub for Entrepreneurs, where we help support you to grow a profitable business, as well as provide monthly trainings and support from other like-minded business owners. Check that link out below. Okay, so let's get back to how we got here. This is probably going to be kind of a long video, but I really want to be detailed in this and ensure you understand what this alternative is and how it works, because I myself had to do a lot of research to fully understand this because it was a little confusing, but I just want to make sure I cover most of the bases here. This is for the United States. Personally, I had some struggles with health insurance. I never really needed it up until giving birth to my son, and thereafter I had it through my employer, but I didn't ever really have to use it for a while. Then becoming self-employed, I didn't have anything, and once I did get health insurance for my family is when we started having situations come up, and it was just a nightmare and so frustrating. Just some examples of why I hate health insurance. I'm just going to be straight up. I think the system is broken in this country. I don't know this full solution, but I think the health share I'm going to talk about today is the solution. I've had situations where I did have health insurance through my employer. I had an injury on my foot and we couldn't figure out what was wrong with it. The x-ray wasn't showing anything broken, but I was obviously in pain and swelling and not getting better. So my doctor ordered an MRI. I had to wait forever to get approval for that MRI from the insurance company. I don't understand that. I don't understand how they can dictate your care and your health in this way. Obviously, you're paying them, but I just don't think it's right. And then I went to the MRI place and I said, can I just pay cash for this? I'm in pain. I just want to get this MRI. And they said, we're not allowed to do that. So contractually, they cannot accept self-pay if you have insurance. I hate those limitations. It was so frustrating. After my son was born, we switched to a family plan. I had been on a plan just for myself during pregnancy. I'm going to talk about pregnancy later in this video. But of course, once we get that health insurance, things go wrong. Well, we thought it was the bear plan, and we never had any issues between me and my husband. We never had health issues. Like I said, I had barely used health insurance up until then, but I wanted to have it for our family, especially with a newborn, just in case anything went wrong. And then of course, that year, things went wrong. My husband, for example, broke his hand, and I thought, of course, it's going to be covered. It's like an accident. This is like a bare minimum thing. He needed to have surgery, and they basically were like, he needs to have surgery tomorrow, and you need to pay for it right now, and it's not covered by your insurance because our insurance didn't cover outpatient surgeries. So that surgery was about $3,000. He had to have physical therapy, and that was not covered. So that was another $1,000 in physical therapy. It did cover some of his appointments with his surgeon, oddly enough. I don't understand. But that's the thing, is I don't understand. Why is it so complicated? The other thing I personally ran into is when I had issues with insurance, I would call and I would be sent to a call center in a different country where the person was just reading a script off a computer screen and was completely unhelpful. Did not help my problem. Did not help me escalate the problem. Did not help me solve it. Did not give me any guidance how to solve it. It was awful customer care. All of that led me to last year. I knew that we were going to be trying for a second baby soon, and I didn't want to have the same experience I had the first time in pregnancy with health insurance, which I will talk about later. So I found New Health Share. There are other health shares out there. This is the one I went with, and I have been so happy with my experience. I signed up knowing I was going to get pregnant later on. If you're already pregnant when you sign up with them, it will not be shareable on your plan. So I did it in advance, and I'm so happy I did. So I'm going to explain now finally what a health share is and how it works and my experience with it. I also want to say, just like health insurance, the membership does have stipulations. It applies to everyone. It's not like each person has different stipulations. Their member guidelines are online on their website. I'll link to it below. So I'm going to do some overview information here, but if you have questions about particular needs or things you foresee happening in the future for your family, make sure you do your own due diligence and check out their member guidelines. So the way a health share works is every member is making a monthly contribution. I think of it as like you're putting money into a big bucket, and then when a member of the health share has a situation, New Health calls it a need. Then they can submit to have that need shared and money taken out of the pot for their need. So you can go on the New Health website and really quickly get a quote for your family, your age range, all of that. But basically you'll see when you get a quote that you can pick what's called your initial unshareable amount. So this is the amount that you will be responsible for when some need arises. So let's use my husband's broken hand as an example. He breaks his hand, that is considered a need. He goes to the ER, then he goes to a surgeon, then he gets surgery, then he gets physical therapy. All these things happen. So what would happen in that case with New Health is you submit the need saying, hey, broke the hand, here's the initial ER bill, because that's the first bill that comes in. And then our family is responsible for paying that initial unshareable amount. When you sign up, you can pick what you want your, I'm just going to say the abbreviation IUA. You can pick what you want your IUA to be, and that's also going to help determine what your monthly contribution is. So if you want, you can make a higher monthly contribution but have a smaller IUA, or have a smaller monthly contribution and a larger IUA. I chose $1,500 as my family's IUA because it's kind of middle of the road. I liked the monthly payment associated with it, and I thought out the various scenarios of what could happen and if I was willing to pay $1,500 for something. So in the case of my husband's broken hand, what would have happened if we were with New Health is we would have paid $1,500 towards the ER bill or surgeon bill, whichever bill kind of comes up first, and then we would submit the other bills, and New Health would determine if they are shareable, and if they determine they are shareable, then they send us the money to pay the rest of those bills. You do have to show New Health that you've paid your IUA, and then they will basically reimburse you for the rest of the expenses. So in my husband's case, instead of us paying $4,000+ for surgery, physical therapy, I don't even remember what the ER visit was. I think insurance covered a little bit of it. Instead of paying over $4,000 for his injury, we would have only paid $1,500, and the rest would have been shared, whether it was a surgeon appointment, physical therapy, whatever needed to happen to handle that one specific medical need. The cool thing about New Health too is they are obviously looking out for their members. They want to make sure that a need is actually shareable, of course, but that when there is a shareable need, that the cost is reasonable. So when you go into a doctor or an ER or whatever it is, you are coming as a self-pay patient at that point. You technically are not insured. And a lot of times these places will actually give discounts for self-pay. And a lot of times with hospitals, they overbill. So New Health will negotiate the bill down. So maybe originally we were going to have to pay $3,000 for the surgery, but they negotiate it down to $2,000 instead. So this is how they're saving money for all of their members, because they are negotiating down this shareable need. One of the other things that I really love about New Health and is a huge benefit over health insurance is you get to pick your provider. So you get to pick your primary care. You get to pick, if you break your hand, who you want to go see. You get to pick who your care is with during your pregnancy. You are not limited to your in-network providers. The other thing I really like about New Health is there is preventative care credit. They actually care about your health and taking care of yourself so that you don't get sick down the road and need some sort of expensive medical cost. They have different discounts and access that you get along with your membership. Things like health and life coaching. They put on health webinars to educate you on things. They have have a supplement discount program where you can get discounts on vitamins and supplements. You also get access to an online fitness software. So they are really invested in you taking care of yourself. Some other things that are shareable that fall into this preventative care category are women's wellness visits, annual physicals, vaccines, colonoscopies, mammograms, babies' wellness visits, birth control, and general lab work. Also, really cool, you get a $200 a year self-care credit. This is just for your whole family. So it's not per member, it's per membership. So for my family, we got a $200 self-credit this year. And this can be used on things of preventative measures. So things like chiropractor, gym memberships, acupuncture, nutritional supplements, things like that. Personally, I see someone for functional medicine, so I take nutritional supplements and I was able to get reimbursed $200 towards supplements that I had purchased. I think that's pretty cool. Like, you do not see health insurance doing that. They don't care. They don't care about your preventative measures. They don't care about preventative care. So the next thing I wanted to highlight was specifically pregnancy. So if you or your family are planning on having kids in the future, this section is for you. As I mentioned in the beginning, this is one of the major reasons that I switched to New Health, and I researched this very thoroughly before signing up with them because I knew that we would be trying for another kid. I am actually pregnant with baby boy number 2 right now, so I've been experiencing pregnancy on their program. Obviously, I haven't delivered and had that experience, but I can fill you in on how it's been going so far. So first of all, with my first pregnancy, I again had a kind of a bare minimum plan of health insurance, and I just had so many bad experiences. The main thing was customer service. When I would call the insurance company with questions or needing help with something, it was really hard to get an answer and actually get help. So for example, most health insurance companies, you get a breast pump for free. So I submitted for that breast pump. So time passed, my delivery was approaching, I still didn't hear anything. So I called them and I said, hey, I submitted for this. And then they said, okay, we need a prescription from your provider. I submitted the prescription for my provider. I still didn't hear back. I ended up delivering a week early, which I really didn't anticipate. And basically when I called them and complained and I said, hey, I gave you what you needed and I still don't have this breast pump, what's going on? They said, okay, we'll look into it and get back to you. In that time that I was waiting for someone to get back to me, I delivered my baby. Due to the circumstances, I needed a breast pump right away. I ended up having to pay out of pocket for it. And then I get a letter in the mail saying you did not submit the proper paperwork. So why didn't anyone just tell me that I needed to submit proper paperwork? I didn't know that. Every time I called customer service and talked about this, no one helped me. I was so frustrated with that. And I had a $3,000 deductible for delivery. And then my baby had a $3,000 deductible. So I had $6,000 right there. I wanted to go to a birth center, which was not covered by insurance. So I pay out of pocket for that, which was several thousands of dollars, I'll just say. I did end up having to transfer to a hospital, and that's where the deductible came in, is they did cover that part. But I paid a lot of money for that. I paid thousands and thousands of dollars for that first pregnancy. Okay, well, thank you for letting me vent on that. You can tell my feelings on that, but let me talk about New Health and what a different experience I'm having this time around. The way it's been working is I am going to a traditional OB office this time around, but if you chose to do a home birth or birth center, that would be shareable with your New Health plan, which I think is just amazing. I think some insurances will cover those, but some won't. My first insurance didn't cover it. My initial unshareable amount is $1,500, as I said before. So basically I started paying the initial bills, like initial ultrasound, my first visit to kind of check out the OB office and see if I wanted to go there. And then New Health had me get the self-pay amount from the OB office, which most offices, as I said before, will have a special self-pay package. So basically the OB office said, okay, this is how much it's going to be. It's going to be $4,000 for all of your care. I can't guarantee these prices everywhere. I'm just sharing real numbers with you guys for example purposes. I may be oversharing here, but these are the real numbers. So my OB office said it's going to be $4,000. You're going to do 4 payments of $1,000. So what I've been doing is as those payments come up, I pay them. I put it on a credit card so I get the points. Hot tip. The points are the cash back. And then I submit to to New Health. I give them the receipt showing I paid, and they reimburse me that. So once I hit my $1,500 threshold, whether it was like some little bills built up, ultrasound here, whatever, once I reached that threshold, they started reimbursing everything above that. That was considered shareable. They also had me call the hospital that I'm going to deliver at ahead of time and get their self-pay pricing there, which that was super eye-opening and ridiculous, because let me just tell you, when I told them, hey, I don't have insurance, I want to plan ahead, how much is my delivery going to cost? They gave me their special self-care rate. And let's just say it wasn't that much more than the deductible that I paid the first time. How does that make sense? How does that make sense? I don't know. But anyways, this gives New Health a heads up of what they're looking at, and they can plan ahead. And they also just want to make sure it's not something exorbitant like $50,000 or something like that. But the quote I got from my hospital was very reasonable. An important thing to note here on pregnancy is, as I stated before, your pregnancy will not qualify as a need if you're already pregnant when you sign up. Basically, if you get pregnant, it has to have a delivery date of at least a year after you initially sign up. So it's really easy. I signed up on January 1st of this year. My due date is in April, so that's plenty of time. I fall within the correct window. So basically, if you sign up for New Health and you're planning on getting pregnant soon, you are going to have to wait about 3 or 4 months before you conceive. So just keep that in mind. So if you are planning on trying to get pregnant soon, I would just sign up right now and then wait a few months before trying to conceive. So things that are considered shareable on the pregnancy side of things are obviously routine visits, routine ultrasounds, routine lab work. There's certain lab work you got to get throughout pregnancy. And I was pleasantly surprised that on this list is 9 chiropractic appointments and 2 pelvic floor physical therapy appointments, which can be either prenatal or postnatal. So that is huge. Things that are not shareable are basically things that are kind of elective, not things that are absolutely necessary to the pregnancy. So these are things like genetic testing, 3D ultrasounds, which is like the fancier ultrasound where you can actually see the outline more of your baby's face, doula services, placenta encapsulation, circumcision. These are all things that are your choice. They aren't completely 100% necessary in order to have a healthy pregnancy and a healthy baby. The other thing is breast pumps are not shareable, but you know what? It wasn't shareable the first time around for me, so I don't really care about that one. So basically for pregnancy, I'm going to pay that $1,500 IUA, and then I do have some other things. I got some other tests. I might want a doula. I haven't decided yet, but still I'm probably looking at maybe $3,500 out of pocket max. Whereas with my first pregnancy, I paid thousands and thousands and thousands of dollars. Obviously part of that was so that I could have the provider I wanted. But again, with New Health, that's not a factor. You get to pick your provider. So right there, the savings is incredible. Same with my husband's broken hand example. Obviously, I'm very passionate about this. I know the struggles of having not good health coverage, having to pay for yourself ridiculous amounts. And my monthly contribution with New Health is probably commensurate to what I was paying for a bad health insurance plan. I want to save you money. I want you to be able to protect your family. I hope this was informative for you. Make sure you check out New Health below. Their member guidelines are available for you right away. If you want to check those out, you can look at your specific needs, what you think your family's going to need. They also make it really easy to get a quote online. You can just fill out your family's information, your circumstances, and then you'll get a quote on the different monthly contributions that are offered to you. Their customer service is also really great. You talk to an actual human being who actually cares about your problem and tries to help you. It's not just a robot reading things off of a computer screen. So if you have questions, even before you sign up, you can call, you can set up a consultation call. So if you can't tell, I'm really happy with New Health. Click below. This is my affiliate link, full disclosure down below. But if you click that, you can get started right away, get that quote right away, and protect your health right away. And then also for business owners watching this, I highly suggest you check out our free community, Growth Hub for Entrepreneurs. This is a free group where you can come together with like-minded business owners and help each other to profitably grow. So you can interact with people who are going through the same things that you're going through. We also provide free trainings in there. We have a new one being added every single month. So if you join today, you'll get access to all the previous trainings. I would love to have you in our community. So click below and I will see you there.